Hello everyone, welcome to my ophthalmology DAT. This is the first video. We're going to talk about the external eye anatomy and some possible causes of a red eye. So to begin with, I'm really sorry I can't do my left and right, so there's actually going to be a right eye, so ignore the L that I've written there. So this is supraciliar, otherwise known as an eyebrow, and then here's the right eye, and supraciliar being above cilia. Cilia is also the eyelashes. And so here is the right eye and your cilia and the lateral and medial canthus. And then there's the upper lid fold and the lower lid fold, and also the upper and lower lid margins. On the medial side, you have the upper punctum and the lower punctum. And then here's your pupil with the iris and your corneal limbus. And here's the plica and the caruncle. So above the lateral medial canthus is the upper eyelid, and below this is the lower eyelid. And the opening between these two is called the palpebral aperture. So a quick run through of what can cause a red eye in the external eye. You can have an entropion or an ectropion. An entropion is simply an inverted eyelid. This causes more of a severe red eye than an ectropion. It is most often caused by aging, and the inturned lashes can abrade the cornea, causing infection, ulceration, or perforation if severe. And to manage this is to do a surgical reposition. An ectropion is the opposite, where the lid is everted. It can be caused by multiple things, including involutional, which means age-related lid laxity. It can also be caused by scarring, so scarring from trauma, for example, and the scar pulls the lid down. Other causes include tumour and benign lid lump. And the management of this, again, is surgical reposition under local anaesthetics. So moving on to the eyelashes, you can get trichiasis, which literally is just lashes that have grown in the wrong direction. And you treat with epilation, which is literally plucking, and you're likely to have a recurrence of trichiasis. Other options involve surgery to destroy lash follicles, which are more permanent treatments. Blepharitis is a very common condition. It is the inflammation at the root of lashes and is commonly associated with staph overgrowth. The management of this is lid cleaning, short course of antibiotics, and you may want some steroid drops, and you may want some ocular lubricants, which are artificial tears. Another thing we can talk about is ptosis and the differentials of ptosis, but we can leave that for another video. So now we're going to move on to the lacrimal apparatus, which is your tear production system. So here we are again, a right eye with your pupil and your iris. And on the superior lateral side of the eye is the lacrimal gland, which is what makes your tears. And it is divided by the aponeurosis of the levator palpebrae superioris. It is divided into two parts, orbital and palpebral parts. The tears then drain towards the medial side where the punctum is, into the superior and inferior lacrimal caniculi. And then it drains down to the lacrimal sac, onto the nasolacrimal duct, and then past the inferior meatus of the nasal cavity, and to the middle nasal concha. And all the structure will be the same for the other side, so the left eye will have its own lacrimal gland and its drainage system as well. And here is the maxillary sinus underneath the eye. Just an additional note is that to always evert the eyelid when you do an eye examination to check for subtarsal foreign body. That's another cause for a red eye. So the last pathology I wanted to cover in this video is dacryocystitis, cystitis, which is caused by an infection of the lacrimal sac, which obstructs the nasolacrimal duct, and that can cause stasis of the fluids and predispose you to more infection. So it presents with erythema, pain, and swelling of the medial canthus, and epiphora, which is excessive production of tears. So the management of this is chloramphenicol drops or comoxiclav tablets.
So just to quickly go over the vasculature of the lacrimal apparatus, the lacrimal artery is a branch of the ophthalmic artery, and this supplies the lacrimal apparatus. And the blood is then drained into the superior ophthalmic vein, which eventually goes to the cavernous sinus. Innervation-wise, it is supplied by the lacrimal nerve and parasympathetic fibers. The lacrimal nerve is a branch of cranial nerve V1, which is ophthalmic branch of the trigeminal nerve. The parasympathetic fibers are carried by the greater petrosal branch of the facial nerve and the zygomatic branch of cranial nerve V2, which is the maxillary branch of trigeminal nerve. And lastly, the lymph fluids are drained into the superficial parotid lymph nodes, which then drains into the superior deep cervical nodes. So that's all for this video. Thank you so much for tuning in. Hope you liked it.